One very important disease in our dairy industry is mastitis, or inflammation of the mammary gland in our dairy cattle. Mastitis has many different ways of classification, but one classification is clinical mastitis, where the milk is abnormal when you strip the milk out of the cow. And the second category would be what we call subclinical mastitis, where when we strip the milk out of the cow and look at it, it actually appears normal, but it does actually have too many white blood cells or epithelial cells in it. So it has a very high somatic cell count. So in order to determine if cattle have subclinical mastitis, we use a cow-side test known as the California mastitis test. This is the paddle that we use to determine whether or not these animals have a high somatic cell count in their milk. Each one of these separate wells signifies a different quarter on the cow. You can see each one of these wells are labeled by a different letter. But the one thing to always remember, so you don't make a mistake, when you take the milk and put into each of these wells from each quarter, it's best to always keep the tongue of the paddle towards the tongue of the cow. So in this case, if we approach the udder from the left side of this cow with the tongue of the paddle to the tongue of the cow, this particular empty well, when we strip milk in, will always be the left front quarter. And this one will always be the left rear quarter, and continuing on with the other quarters with each well. Once we retrieve milk from these cattle, we add in a reagent which looks like this. It's typically purple, and it contains different compounds, one to test pH, and the other compound will actually lyse the white blood cells, releasing their cellular contents, which typically is very tacky, and they want to stick to each other. So the result when we read this examination is the stickier or the tackier or the thicker the solution becomes, the more likely we have high somatic cell counts, indicating that animal may have infection in that gland. So I will demonstrate taking milk and putting it in each of these wells and then adding the reagent and testing this particular cow with the California mastitis test. So the first few strips of milk, what we try to do is just strip them onto the ground always. And then what we do is we strip milk, again, tongue of the paddle towards tongue of the cow, and taking milk from that quarter into that well. Then we actually go to the next and we proceed adding plenty enough milk into each one of these receptacles. Once we're finished adding enough milk to the receptacles, what we will do is we will tilt this device over to the side. This paddle would be tilted to make sure we have an equal amount of milk into each well, and it looks like we have an equal amount of milk in each well. And then we add an equal amount of reagent to milk per well. So this isn't an exact sort of measurement. It's cow side. We just try to guess or estimate how much milk is in each of these wells, and we add the reagent to each of these wells. And then once we have enough reagent in each, we start to just rotate it and shake it and rock it back and forth and rotate it back and forth until we get a complete mixture of the reagent with the milk. Again, like I said earlier, the test is scored according to how thick the solution becomes. If we see a mixture that continues to be very watery and liquidy, that typical test would be a trace or negative. And then the scoring system will go 1, 2, and 3 beyond that. The higher you go with the number to 3, the more cells are actually in that gland, creating a thicker solution. Millions and millions of cells. So in this particular case, we have a cow that's produced different sort of results according to different quarters. For instance, as I walk away from the cow, because I always know tongue of the cow towards tongue of the paddle, no matter how I hold this, I know this will always be her left front. And this one is a bit thicker and tends to be a bit more tacky and not so liquidy. But the most striking one in this result is actually her right hindquarter. You also notice that the color changed differently, again as a pH indicator. So she actually has a very severe amount or a very high level of white blood cells or somatic cells into this whale right here. So to make it even more dramatic is if I tilt it over and allow it to pour out, you'll see it sticks together and comes out in one big giant clump, which indicates a serious infection in that quarter. So in this particular cow, her right hind quarter has subclinical mastitis, and possibly if we strip longer, we may actually find that she has clinical mastitis. This is a great cow-side test to determine which quarters are high in somatic cell counts and maybe need treatment.